Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café, and today I have with me Dr. Wayne Phimister, and let me tell you a little bit about him and then we'll take it from there. So he's a family physician and clinical assistant professor at UBC, clinical instructor at Stanford University in the USA, and author and speaker who is dedicated to finding solutions for people suffering in chronic pain. Now, he is trained as an MD and family physician in his country of Scotland in 2000, and then moved to BC in 2003 after work in New Zealand. And you also certified in medical acupuncture, intramuscular stimulation, which started down an entire journey, which I think I'm just going to ask you to speak about all that.
Sure.
So welcome.
Well, thank you. It's been a great privilege to be invited on the Healers Café. I love the name.
Well, actually, before you tell us all the things you've learned, what is it? Because that's really my main question I'm seeking answers to. What made you decide one day or at one moment in time that you wanted to become a doctor or a healer, or what was that? When did that start? How did you know?
Well, my first thought really was age 17 at high school, when I had to decide what I was going to do and go off to university to study. And I had a tendency towards the sciences, and I was an average student, but I really enjoyed studying. And then I decided that I wanted to help people, and I wanted a challenge. And where that came from, well, who knows? But it just came from somewhere, and within me. And as I reflected on this question before, I did have an experience age 5 where I had a near drowning experience. And I was at a swimming pool with friends. My parents were there. We were on holiday in the north of England. And we all went down the slide into the water, and there was lots of waves, and none of us could swim.
I see.
And all of a sudden, I think I went into a shock response because my friends were rescued by my dad, who pulled them from under the water. But the lifeguard dived in and saved me. So there was no, ill health that I'm aware of, that I was told. But, after that, I learned to swim and became a very proficient swimmer, a national level swimmer, in a very short period of time. But maybe there was something in there that, made me face my demise, as it were, or potential death, and shocked me into a path of helping people. And that's certainly why I did medicine. And it's funny because when I think about medical school or becoming a doctor, that was never part of my mindset. It was always just to help people. I want to help people, but I want to do it with a challenge. So if we move forward over 30 years now, that's exactly where I am. I'm still wanting to help people, and it's a huge challenge because what I've realized is there's a difference between medicine and healing, which is kind of strange because the origins of medicine was all about healing.
Correct.
But now we're finding, as the predominant theme of medicine is assessment, symptoms, signs, diagnoses, investigations, treatments. And, the majority is medications or surgeries. And that's what we're trained in. And there's other things as well, like therapy and counseling, injections. But the word healing and the word stress and the word trauma is not in the curriculum. And that's maybe changing a little bit, I would say, based on my students. But what I was trained in, that's a different language. So it's taken me a long time to realize that. And here we are at the Healers Café.
So you wanted to help, and at that point, doctor was, you could have become a lifesaver, but that's not challenging enough. So, but why medicine? Do you have any clue why that was for you?
I think for me, it was a natural progression from the sciences at high school, and I enjoyed them, and I was quite good at them. And I knew at the end of the day, I'd be helping people because that's what doctors do. That's, at the age of 18, I went off to Aberdeen University. And in Scotland, that's when you start university for medicine.
Okay.
So that just took me through a journey of a little bit of biochemistry. I did a intercalated medical degree in the middle and taught me I didn't want to do research or pure research. So I ended up, interestingly, being a family doctor because my intention was to be a pediatrician. And it was the last 4 weeks of 6 years. It's crazy looking back. The last 4 weeks I sat in a family doctor's office and I thought, oh my goodness, this is me. And, I came from a small town in the northeast of Scotland and just working class background and just sitting in that office talking to people about their everyday issues, symptoms, life. I just connected with it more than I did in hospital medicine and the research world that I'd been trained in. And I just thought, this is what I need to do. So off I went and trained in family medicine. And I loved it. I did it, trained for 10 years total and then 20 years now as a qualified GP. And up to about 3 years ago, I did full-time family practice in the small town of Agassiz in BC and doing full service practice, which was cradle to grave. And it was delivering babies. It was hospital ward rounds, hospice care, nursing home care. I was medical director for 2 nursing homes in Agassiz for a year. So I just really enjoyed the breadth of experience from the simple consultation of walk-in clinic, which, is not my forte, but it's actually more challenging when you're very comprehensive to do it in a efficient manner. So I kind of used every situation I found myself in to just help people and connect with people first and foremost and listen and do my best in that moment for them in that journey of their path with disease and healing.
Yeah. And so how have you found there's, I have a lot of doctors who have come to see me as patients and they're saying, oh, you're so lucky to be a naturopathic physician because you can do your own hours. You can actually listen to a person's complete story. There's an emphasis in the connection if you want it, right? Now, we're not all the same breed. We're not all the same, in that sense, everyone's different, but we have that choice. How was it for you? Because I've heard different stories, of not having enough time or it's a question of choice. Was there a difference for you in Scotland than here? Sort of explain a little bit what your experience with the potentially the limitations of the system, if you see it that way. I don't know if you do.
Yeah, I think it's walking a fine line because within the medical model in Scotland, it's very different with the NHS and in the UK with the NHS where you get per capita based funding. So you get X number of patients and you look after them. And whereas in North America, as we know in the medical system, it's fee for service. So the more numbers you see, the more money you make. Now that's not entirely true, but that was the case when I came here for about 10 years. And now it's changed to rewarding family physicians who do spend time with patients, like counseling fees and chronic disease management, which is fees for providing a service for the entire year, depending on the disease or diseases. So the remuneration is more fair now. And the flip of that was we're not penalized for spending time with patients. So, I think for me at the end of the day, it wasn't about how much money I can make. It was always about just helping my patients, this patient in this moment. And if I run behind, I run behind. And that's maybe not the best for time management and other people time schedules, but that's probably one of the most challenging things I found because I was so interested in helping them. And I had to realize I can't do everything, especially in one visit.
Right.
And, the great thing about being a family doctor is you can use time and use multiple visits and more of a connect with the patient and advise, and then use follow-up visits to follow up. And then you get that, most patients only remember 10%, 15, 20% of what we say anyway. So by saying less and maybe listening more and advising less, then if they do it, and then we get that follow-up success with outcomes or follow-up success with advice, then people do move forward. So it was interesting, it's
Interesting. Yeah.
It's one of those things you deal with as a family doctor.
And I didn't realize Scotland was the same system as the UK. So yeah, that's interesting. Yeah, it must have been a shock, but I'm glad then that it's changing now here. So how long has it been different?
It was about 10 years ago, just from my memory, approximately 10, 12 years ago, maybe, I think it started to change. Yeah.
For the family doctor then?
Yeah.
Yeah.
Yeah, exactly.
Yeah, interesting. Yeah, no, because I know that in my my family goes, my mother, and it's like one symptom, you can't talk about several things. And she's not, she's not brought up like that, having come from Europe. And I guess, it's like, I'm a whole person. Why do they only know that? Wouldn't it matter if also I had this? So she goes, religiously and follows everything. But I can hear her frustration. It's like, so how is your experience with that? Or have patients said this to you, or are you able to, how do you deal with that? Because you do have some limited time, and I appreciate the idea that you give small chunks which are absorbable and followable. So that's a really interesting way of looking at the problem. But how do you get all the information you need to not just superficially treat, but to really get to what's going on? Like when you make the distinction about healing, right?
Well, I think, in all honesty, functioning as a family doctor, because of the time constraints, you're there to collect symptoms, and all the symptoms, or as many symptoms as you can. And our job is to go and find those symptoms. But I think in reality, it's more of what does the patient say, okay, and then you get on to that mindset of reductionist model of trying to figure out what they're talking about or what the problem is, and you confirm it with the diagnosis. So confirm it with the examination, focal examination,
right?
And then go down the path of investigations and diagnosis. But we're talking about medicine here. We're talking about traditional medicine where it's a symptom-based world. And what we've been talking about before today, as well as at the beginning, is, well, what is the difference between healing and medicine?
Yeah.
Right? And to dive into the thoughts of the patients, not just the symptoms, but what are the thoughts of the patients? What are the emotions of the patient? And where did it begin? That fear of their spiders, like where did it begin? Or fear of flying? And people never think about these things. And if you ask them, they're going to say, I don't know. Most of the time, because it's subconscious.
Yeah.
Right. And it's only been the last 4 years where I've taken an interest in understanding that mind-body connection and the work of John Sarno that has really pioneered for the medics, 50,000 cases of healing chronic pain, going to the mental emotional perspective and looking at that as the foundation for their pain, and not the CT scan, MRI, or X-ray as the foundation for the cause of their pain. So that mental, emotional, physical areas of life is missed in the busyness of the medical world. And to be fair to us all, medics or medical doctors, is the principles of Descartes, back in the 1600s,
Yeah.
who stated, let's study medicine with a separatist type approach, or a dualistic approach, where we divide the body and the mind.
Yeah.
And that started the downward spiral of missing the boat regarding mind-body connection and healing.
Yeah.
And I think just that really helped me come into the fullness of optimizing my role as a medical doctor and as a healer, because I see it myself as the same thing. And it just allowed me to embody that, and within the context of pain, because that was my personal special interest as a family doctor. And now, just full time for the last about 3 years, just focusing exclusively on that and taking more time and asking lots more questions, especially with my intake form, about their childhood, about their abuse, about their traumas, about their mode of birthing, C-sections and use of antibiotics, and breastfeeding versus bottle feeding, and just diving into the world of the microbiome and what was the precursors for the presentation of chronic pain. Yeah. So, and that's really only in the last year and 3 months that I've embodied that and taken it upon myself, and changed my microbiome by changing my diet. Right. And by reading around the subject of the role of health from the gut, which Hippocrates talked about 2,500 years ago. And here we are today, with a new branch of medicine evolving with the microbiome and genetic coding of that. And there's, leaders in the field, medical field, discussing this, talking about this in books, podcasts, etc. And I hope in the next 10, 20 years, this becomes the normal.
Right, exactly.
It does become the normal conversation. Like, let's get back to basics, everybody. With food.
Yeah, I know. I was actually surprised, that even nutrition, most universities is like 10, 15 hours, something very, just enough to know that there is a subject, but not anything really deeply about it. And it's like, the idea, like you said, of Descartes, that separation is like, well, we're also completely separate from the way our whole organism works, right? We're still, we have specialists for every body part, but not the whole, so it's interesting. So do you feel that this is definitely like a trend towards more, integrative, more holistic, approaches to the whole being that's happening?
I don't think it's happening yet.
Maybe it's something just people I hang out with.
No, it's I think that the students coming out are asking questions to their professors and educators about the role of diet and cardiology, for example. Right. So I think we're a long way from seeing it as a reality. And I don't know what it's going to take. I know it's going to take a long time, 20 years.
Well, there's so many pieces to it, because it's become kind of like a machine. It's like there's the practitioner, the doctor doing the best they can with all the, everyone studies things that either they need to for themselves, for pain, for health, for gut health, whatever it is, right? So everyone does their homework if it involves them or potentially a patient. And then it's like, you're still stuck with a diagnostic system, that has a prognosis that says that certain things can't be changed or cured, and there's these many drugs to take along the path. And that's a very big machine. It's the pharmaceutical complex machine is, at least from what I'm hearing from other doctors, is like, some of them have said, I feel like I'm a pill pusher. And I'm like, my goodness. So yeah, I don't know. Like, I think it must be hard because it's, you can come from another place in your heart or a desire, but the system it's quite a strong system, because if you're not in it, you can witness it as well, acting quite differently. Even anyway, let's not talk about what's happening right now, but it's interesting, how, and let's talk about pain a little bit because, that is your specialty. And I'd love you to share what you've seen and what impacts pain, like more, give us a little bit more, what opened you to realize that, that there's more to it.
Well, coming from being, I had one patient, funnily enough, did call me a pill pusher once. It shocked me. It was like, I don't believe you said that about me. But she was right, because we're trained and that's what we do. And as you say, there's a role for this, but there's also a bigger piece of the pie we need to be looking at. And I guess curiosity was one of the main factors, and openness. And, I did train in medical acupuncture within a month of becoming a family doctor. And that was because I had a friend who was an acupuncturist who helped me get through my initial 10 weeks of work as a doctor, because I was working every day and I was exhausted and fatigued. And he's a 5-element acupuncturist in Aberdeen. And he blew me away with his story and what he was doing. And I thought, hey, I've got to learn this stuff. And I had a great friend, older gentleman doctor, who also practiced acupuncture. And I thought, I'm going to look into doing a course. So within 30 days, I was actually in an acupuncture course. And I was like, so passionate from the word go. I did 30 cases in the first month and, went back for the second half of the course, or the second part of the course, and loved it. And I can't explain that. It was working. Tennis elbows would go away if you did large intestine 11 one point here in the crease of your elbow, along with, large intestine 4, one of the pain points in your hand. So I think that was the origin of just getting to this healing concept. And it just felt right with me.
Right. Yeah.
And so that was definitely the start of the pain journey of healing. And then learning with Chan Gun when I came to Vancouver in 2003. I was so busy with medical exams, and I felt I had to do an exam here to be certified in this country. So I trained with him, and really impressed by his insight and his research into Dr. Cannon, or Professor Cannon's work at Harvard back in the 20s, 30s and 40s last century, discovering homeostasis and also fight-flight response, which is kind of the core of chronic pain, I think, with trauma, but also the role of denervation supersensitivity. And Dr. Chan Gun came across this paper in the archives because it was lost. And it just explained all the symptoms that he could see in a patient and the signs that he could see in patients with autonomic dysfunction, like pill erection and cold patches, hot patches, sweat patches, dry patches, and tight, thickened bands of fascia and muscle. And so it all made sense to him, and he was poking people and developing his own style with acupuncture to release this tightened, shortened bands. So when I saw this myself with patients, and I was treating patients with this training, it just all made more sense, like, okay, the body needs to release the tension, and that's what I talk about for years, like over a decade.
Yeah.
So, but again, it wasn't until the use of a medical needle versus an acupuncture needle, and the cutting action of that needle, you could hear a sound as it went through the tissues. And I didn't know what that was, but patients, I have conversations with patients, and I always say, patients are the best teachers because you learn from them and they learn from you. And I could literally change my needle, and I realized, oh my goodness, this is different because it's a different sound.
Right. Yeah.
And what I realized with my insight from my hunter patients, that when you cut up a big moose with a knife, it blunts very quickly because of the sinew in the meat. And so too with the physical human body and the sinew between the muscle layers.
Yeah.
So that was a big aha moment for me. And I think that was a turning point, because I realized if, this working class doctor from Scotland figured something out in the pain world that I hadn't been taught or discovered, even from Chan Gun, then I was onto something. And not only that, but opened the doors of curiosity and openness for other things. And in came Dr. Sarno, and then in came other people like Peter Goskew, world famous physical therapist in the States, who's got over 50, I think it's 25 clinics, 25,000 people a year, with the Goskew method, which is all about postural alignment and movement, and how you can fix pain through just postural change and movement and activities, exercises. So again, this was another area. And from there, it's gone on to the anti-inflammatory diet and Stephen Gundry and David Perlmutter in the States. And now, the role of cold exposure and breathing with like the Wim Hof method, which has been backed up in science. So that's my new area. I think, oh my gosh, wow, there's another thing that we can do for people's bodies to tap into this inert healing that's already there. And we just need to bring it out.
Yeah.
Right? So it's just been one thing after the next, and I've just embraced it. I do it myself. As Gandhi says, you can't really teach anything unless you do it yourself. So I got to embody it and try it and experiment and see what happens, and then start sharing it, and then start getting results, and then auditing it and documenting it and having proof myself.
Yeah.
So,
I think you raise a really good point too, is that, you theorize and understand, but until you actually experience, it's you're not as connected to it. It's like you really need to either see it, hear it. That was very graphic. I have that very big visual right now. Or experience it yourself. Because it's I think like an embodied experience goes a long way to feeling that it's worth and to commit your time and energy to keep in a field, right? It's because there's so many things we can learn, Yeah, no, very interesting path. Yeah. So I wanted to bring a point that you also said about the diagnostics, because actually it's funny. My TEDx talk, which got postponed because of COVID, it starts with Descartes, and so it's quite funny. I was like, oh, this is very interesting. But I also talk about the scans and the research on the scans as well. And what I've seen clinically or in my practice is that it's almost like when they receive the scan as the confirmation, it's almost like that's a visual map of the disintegration of their spine, and they're walking around fearing to move because of what the understanding of what they see is on that, on the scans. And I've had to do a lot of patient education to explain that, well, that's a vision and a end result. It doesn't mean that you shouldn't move or that if we work with your fascia, because as you know, I do Bowen therapy, that your body get rid of that image and put another image of your body able to heal and feel what your body feels like, because if I treat people, they start to feel much better, and then they go, well, what's true, that or this? So have you had a bit this experience with people coming in, with a diagnosis like that and really afraid because of the images they see?
It's a very complex answer now, sitting today. And I'll say that, I'll give you a little story behind it, because I also had those conversations with patients for years. Well, the CT scan says this, the MRI scan says this, but really, you can go and X-ray or CT or MRI people on the streets right now who do not have pain, and they will have the same or worse scans than you. So no pain, and their scans are the same or worse than yours, because that's what the science shows. That's what the doctors who came after Dr. Sarno, like his students, Dr. Schneider, I think, is one of them, who wrote a brilliant book on how to unlearn your pain. And Schichter, I think is his name, down in California, who I've interviewed in my podcast show. So they're wonderful, because they've actually trained with Dr. Sarno, have been involved in these early days and taken it through the last 20 years or so, and pioneering the role of the mind-body connection in the medical field. And, you know, this is where I would come from and just say, yeah, well, this is what the scan says, but there's more to you than that. But I think to bring a layer of complexity, it was highlighted by several doctors on my podcast show, was one is this level of accuracy within an MRI scan and a CT scan is not where we need it to be. And I thought, wow, that's a different angle, because maybe there is a greater intensity of MRI scanning that could identify something that then the medics could go ahead and do a interventional technique to help. And I think we need to be open towards that. And I think as science advances, that hopefully will become apparent. For example, 3D CT scanning.
Right.
So that's one point. And the next point is, what is the position we do MRI scans? And as one doctor says, look, you cannot get an MRI scan standing in Canada. And when you think about it, when you stand, you've got your whole axial skeleton with gravity pulling. And it's a very different thing to lying down in a bed with gravity spread out.
Yeah.
So this dynamic body that we have that always moves and never stays still, really, you know, it's a different picture that you're seeing on a different position. Now, I had to, well, there is one MRI scan in Kamloops in BC here, up in Dr. Brown's office, who's a neurosurgeon, and he does MRI scans sitting down. But I'm not too sure if that's a public or a research or a personal, public or private service or not. But, you know, it's not accessible to most people. But, you know, there needs to be improvements within the world of diagnostics for all of us to do our jobs better. But I think even saying that, at the end of the day, we're not a machine, right? And, you know, and I'll share one story that actually I thought of when you asked me the question of healing, how did it all turn around? And it was a lady called Julie, who for 49 years had stump pain in the right leg after a gunshot wound when she was 16. Had a horrendous childhood with many level abuses. Horrific, actually. And she later told me all of this. But when she walked into my office, and he'd been on narcotics for 49 years, and I, with a lot of courage, said to her, you know, your pain can go away if you redirect your thoughts. And she left my office with the affirmation from Emile Coué 100 years ago in France, who came up with this. Every day in every way, I am getting better and better. You know, you may have heard that. And used in humor and satire and several movies like The Pink Panther with Peter Sellers, or some others do have them in England with Michael Crawford. But that term was taken by Julie and repeated in her mind all day, every day. And I mean all day, every day. Not just 20 times in the morning, 20 times at night, like I encourage people to do, but she embodied it, like her life depended on it, and it did. And the pain went away. And to this day, it hasn't come back in the stump. And I put that purely down to that belief and that persistence thought of something different can happen. And because she opened herself up and was curious and embodied the principles of the mind-body connection, her pain went away. Now, she still gets other pain. She gets back pain that I've seen her a few times, but not the stump pain. Fascinating case. Fascinating.
No, it's interesting.
You know, but that really woke me up to healing and believing in it and embracing it 100%. And therefore moving my career from family to pain medicine with a, you know, as a GP, as a special interest in pain medicine.
Yeah, yeah. Well, you know, when you bring that story up and the power that and the focus she had, you know, that's where I get concerned, you know, again, when I have patients that have received a diagnosis based on a scan that tells them that they're going to be always immobile, or that I had one like where there's fragments of your spine that's probably going to cut your blood vessels at some point. It's like, really? You know, it's so scary. Like, you know, again, I wasn't in the room. This is hearsay. It's the patient telling me their best understanding. But the point is, if that's how they're feeling about it, that's what I mean. It's like, it's, you know, doctors need to be super careful. And I mean, all doctors, not just medical doctors, anyone in the healing profession who can read this kind of work has to be aware of the words they're using and what they're, you know, because the mind is powerful, you know, and we can run into creating limitations by this negative or nocebo, you know, tainted vision of the body's potential, you know. So anyway, it's great to hear a positive story, you know, because of course it depends, you know, in my work I tend to hear the negative stories from trying everything else and they're still in pain, you know. So it's a very biased positioning because, you know, it's not a study, it's a practice. So
It's my experience as well. I would say every patient coming in has tried many things, and they've lost hope. You know, there's no understanding. There's no way forward. You know, I'm just the next guy in the list that they're hoping, you know, I can say something to help them. And it's very difficult from a medical perspective as well as a personal perspective to have that, because that's not what they see. And it's certainly not what the regular GP sees in his practice, you know.
yeah. So do you have any our time is coming to a close, but I still want to give you like a time to share something that could really help people listening to this, whether they're practitioners or patients, you know, about pain, like something, yeah, that you would like to share from your experience.
I would say there's more than one way to heal pain. I think first and foremost, healing pain is possible. And I think we need to listen to doctors, listen to professionals who have created their own path in this field and found results. And I mean, people with 10,000 cases behind them, 10 years of experience. And the other 10 is, or the other caveat is, you know, they've changed their career, or they've redirected their career, and they're sharing and they're practicing in a certain way, because that to me is the evidence of where we need to go. Okay.
Yeah.
And one big thing that's very prevalent these days is our environment. You know, we're here talking, and I love what I'm seeing with you in Bowen Island there, and the beautiful sun coming down behind your backdrop, and the comparison to me with these screens around me, for those who are only listening. But that's a really good symbol of we are more than our bodies. And we need to look at our environment. Maybe it's a relationship that's not healthy for us. Maybe it's friends. You know, maybe it's the actual accommodation. Maybe it's the lack of time in nature. And the COVID has helped us to waken up,
Yes.
to realize our environment is massive in its contribution to our health and our pain. So society pain, or social pain, or relationship pain, environmental pain. And we need to think of that, not just what we're putting in our bodies and how we're thinking, what we've touched on today, and cold exposure, which I think is a huge area, but also the external, with what we do every day. Get out in nature, everybody. Sunlight is, you know, the healer for the Spanish flu 100 years ago. Sunlight and being in nature, right, helped get rid of the Spanish flu. And I think more and more as I study health and nutrition and all the different areas, is this other dimension. You know, are we doing a job that we really want to do? Maybe not. Maybe it's time to take a sidestep and have a goal of something else to bring us more joy. And I think just to finish that up is the role of our heart in our journey. You know, the language of enjoyment, as David Hanscom talks about in backandcontrol.com. And it's like healing has got two sides to it. One is all the activities that we do. And he says the other side of the coin is the language of enjoyment. And we need to embrace, and we need to fully be present and enjoy our life. And the little things, we must start with the little things, the cup of coffee, the chat with a friend, the book that you're reading, doesn't matter. And then from the work of HeartMath in California, clearly shows for almost 30 years of science that heart-brain connection and the electromagnetics that are around us. And nobody defies the concept of magnetic poles on the earth, or, you know, the electricity in our brain or our heart with these investigations we always do. So there's electromagnetic field around us. And when we are in connection with the heart helps to heal the brain. And that's not just through electromagnetics. It's also through the vagus nerve, up through the body into the brain, and then literally stimulate a coherent oneness that allows every part of our body to heal. So the environment and the heart are huge, huge areas I think we need to embrace more and more in this path.
Well, those words, because they resonate so 100%, and you've said it so well. Thank you very much for being on our show. And I look forward to connecting at another point.
Thanks so much.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.